We're going to begin this hour, though, with a look at a potential new booster shot to fight this highly contagious Omicron variant of the coronavirus. Now, the FDA's independent panel of vaccine experts voted on Tuesday to recommend modifying the vaccine for the first time to specifically target Omicron. The goal is to make the new boosters available this fall ahead of the expected winter surge. Now, this comes amid growing concerns about another virus. That one's called the Monkeypox. Dr. Celine Gounder is here again to discuss all of this. She's an infectious disease specialist and editor-at-large for KFF's Kaiser Health News. Always good to have you here, Dr. Gounder. So let's get right into it. We'll get to monkeypox in just a second. I know people who have gotten 2 boosters, 2 vaccines, and now you're saying another one in the fall. What if they say, no, I'm all boosted out? What do you say to that?
Yeah, look, I think we need to remember that the virus continues to mutate. We need to try to keep up with the virus. And even if you have gotten 2 boosters, so 4 doses, I would still strongly recommend getting the updated booster to better match the virus that is currently circulating.
But you have people that haven't even gotten their second booster. Do you think they should get the second booster, or should they wait, or can they just skip over that?
That's a good question.
And get the big booster that's coming out? Because that's what I started to do. I heard it was coming. I go, I'll just wait for that. And my doctor said, nope, you should go ahead and get it now. And I still got COVID.
Right. Well, I would, if you're scheduled to get your 4th dose, go ahead and keep that appointment. These updated vaccines won't be out until October at the earliest, and we don't know what the supply is going to be in October. So it's going to be a little while still yet before you can get that updated booster.
And they're different because what?
So the Omicron variant emerged last fall, and it has continued to mutate. So you have 1, 2, 3, now we're on 4 and 5 that are starting to become the dominant strains in the U.S. And so these updated vaccines that will come out in the fall are to match Omicron 4 and 5.
Now, are we expecting a winter surge? And if so, will these modified boosters help?
Well, that's the idea, is we are expecting a winter surge. People are going to be back indoors, kids back in the classroom. People are very much going to be back at work in person, definitely by then. And these Omicron subvariants, each of them has caused an increase every time they've emerged. And so we do anticipate that with the way number 4 and 5 are spreading, we will see a surge in the fall.
Except that we saw the Omicron variant appear. It feels like it's very 2021, even though it's still here, right? And so you're saying we're going to have a Omicron variant targeted vaccine in the fall. But what happens when that next variant shows up in December? Should the CDC come out and say, look, you're going to have to get shots practically every year?
Or come up with a universal vaccine so you don't have to keep getting these shots.
So what I predict is in the short term, yearly shots will be recommended for elderly people, for people who are immunocompromised. But when there's a big variant switch, that's when everybody will be told to get a booster. But you're right. You know, I think the holy grail would be a universal coronavirus vaccine that would cover all variants. The problem is we're still years away from that. We don't have an Operation Warp Speed, with lots of funding and resources to move that along.
So it's like the flu, though, because we get flu shots every year, and every year the flu is a little different. It's not the same flu shot that we received in the prior year. Is that what we're looking at?
Well, we don't know what the tempo is going to be with the variants. So will that be a yearly switch? We don't know yet.
It's monkeypox. Let's talk about that before you go. Monkeypox. How serious is it? How concerned should we be?
So right now, monkeypox is spreading actively among men who have sex with men. So gay men, bisexual men, as well as trans women. But at least in Europe, where they actually are reporting the breakdown by sex, at least 10 women have gotten monkeypox. And it's only a matter of time before this spreads in the rest of the population. Monkeypox can be really deadly and dangerous in pregnancy, to the fetus, to the mom, of course, and to the newborn. And that's what we really are why we're trying to nip this in the bud before that kind of thing happens.
And so how do you protect yourself against monkeypox?
Well, it's spread by direct contact with people who are infected with their active lesions, which could be anywhere on the skin, as well as the mouth, the genitalia, the anus. So those are all areas that could be infectious. You can reduce your risk of spread by, say, using condoms, but that's only going to reduce risk of spread with the skin that's covered.
And if you get it, is there a vaccine? Is there a pill? Is there a vaccine?
There is a vaccine, so that's being released from the Strategic National Stockpile now, and we're trying to accelerate the completion of doses that are with the manufacturer right now.
All right, Dr. Celine Gounder, always great to have you. Important information. Thank you very much.